Well, hello, and welcome to another edition of Dialogue with the Dean, bringing you more campus updates and college updates, and we hope that, again, you find these videos informative. Before we start, I just want to remind everyone that if you have any questions at all about the topics that we're going to cover today, please feel free to leave some comments there on the comment boxes, and we'll return and address your questions. Well, today we have with us two guests, Marlene Heeg, who's the Managing Director of the Office of Continuing Education in the College of Pharmacy, but she's also our professional development person and the Purdue Online Administrative Lead to support the college online programming. And we have Dr. Kyle Hulgren, Director of the Center for Medication Safety Advancement, and our college's faculty lead, sort of a relatively new role for Kyle, to support our online program content development. So Kyle, Marlene, thanks for being with us today. And what we're going to talk about is some work we've done over the last few years in pharmacy technician training. And so let's start out with maybe a broad question about, tell our viewers about the pharmacy technician program and what specifically makes this program accessible and valuable to the students enrolled. So Marlene?
Thanks. So we actually started this whole concept in 2020. I think you had offered direction for us to really look at, is there a need for pharmacy technician training? You had commissioned our pharmacy management team, both Nicole, Noel, and Trexie Rudd, to put together an outline, which then was passed over to Dr. Cindy Konak-Sharp to serve as the content developer in collaboration with our online team, Debbie Runchie, our senior instructional designer. And they worked then through the rest of that fall and winter so that we could actually launch the program in the spring of 2021. And we decided at the time to do a soft launch and have PPHS be the partner, Purdue Polytechnic High School, because of the collaborative and strategic partnership that we have with PPHS. So the program is a whole semester. It's 16 weeks. It's 4 modules. And the content, just so I don't miss anything, I'm going to give you the modules of the content. Pertinent drug and medication information, federal and state laws and regulation, order, prescription, entry and processing, patient safety, and quality assurance. And that is covered over that time. There are weekly homework assignments as well as tests to cover the 200 top drugs that a learner needs to know to be able to pass the test. And there's a midterm and a final.
So upon successful completion of the course, what can students expect in terms of finding employment? Are they looking primarily at retail pharmacy settings, hospital settings, but what are we learning?
Well, of the students that have successfully completed our course, part of the tuition for the course includes the practice exam that PTCB offers, as well as the proctored exam. And once they successfully complete that and are certified as a pharmacy technician, they have the opportunity to become a pharmacy technician through collaborations that I have with pharmacy directors in both the retail side as well as the hospital side. The students that have successfully passed have actually been provided with positions within a 2-week time frame. So I think the students are more interested in having something that they can do where they are. So if it's hospital, that's fine. If it's retail pharmacy, that's fine. Some of them have done that as a full-time job out of high school, and some of them have done it as a supplement to help pay for their tuition to go to college. I think what's interesting is our sweet spot is the high school senior. And that's really what Kyle and I are going to continue to pursue, to look at not only Indiana but surrounding states to see if we can really expand the program to other organizations throughout the 4 or 5 states.
So you're talking about expansion beyond Purdue Polytechnic high schools. Where else have we been able to sort of experiment a little bit with this?
Thank you for that question, because we did experiment and actually ended up creating an 8-week version of the course with the Medical Professions Academy, which is a special academy established in Evansville, Indiana, the 5 high schools got together and put together the academy for high school students that are interested in possibly pursuing a healthcare career. So they do half of their education during the day at their high school, and then the other half they go to the Medical Professions Academy. We did that because they asked for something that the graduates could look at during the summer before they pursued either a full-time job or college education. So we have an 8-week version, we have a 16-week version, and we've even expanded that now so that anyone that looks at our site, either from our CE site or from Purdue Online site, because everything we have here is posted there, they can take the course as well.
Great. Well, Kyle, this is a question for you. It's no secret that pharmacists have become very much in demand, and certainly technicians are very, very much in demand. And certainly we know that our pharmacists still are the most accessible healthcare provider in the country. But how can a pharmacy technician be a critical part to supporting this need in pharmacy across the nation?
Great question, and demand is the absolute right word. It's being driven by increasing demand from the people we serve. People are coming to our community pharmacies now, and they know that they have greater access to things like an entire slate of immunizations all the way down to just almost any age for the children and adults. There's more clinical services involved, whether it be through identifying medications and medication therapy and working through a lot of things. So the community pharmacy has taken the most accessible professional and granted more access to people to get taken care of. And so a real key to this is going to be the pharmacy technician and continuing to broaden and deepen what they're able to work on. There are already a number of states that have programs that are working on getting technicians to be able, or advanced technicians to be able to immunize or to help problem identify and help pharmacists look for patients to be, doing some more of those counseling and some of those services with as well. And so really taking this technician model and providing them in a lot more of those roles that we've traditionally found pharmacists in, some of those revenue roles, things where we're talking about identifying or setting up immunizations, giving immunizations in some cases, and continuing to move in that direction as well.
Well, typically in this forum, we give you guys a chance to ask me a question, and I think you have a question for
We
me.
do have a question.
All right.
Because it's the two of us, we combined efforts to come up with a question, which
All
I'm going to read. How do you see the role of the pharmacist and the pharmacy technician changing in the future? And as a result, how will that impact the role of pharmacy technicians? And what can the College of Pharmacy do to assist in preparing the technicians for these new responsibilities?
Well, it kind of goes back to some of the things Kyle was saying. There is no question that if we are to unleash the full potential of our pharmacists, we have to have a highly skilled technical workforce that supports their efforts. And so our role in training clinicians in the Doctor of Pharmacy program is central to who we are, but now the need for pharmacy technicians to enable our practitioners is really, really important. So one thing the college can do is be advocates for expansion and scope of pharmacy technicians. And so advocating here within the state to expand scope of practice for our pharmacy technicians, I think is really important. You mentioned health professions and Health Professions Academy. I think pharmacy technician programs also can be really key to recruitment into health professions. We'd like them to come to the College of Pharmacy, but if they get a pharmacy technician license and work as a pharmacy technician, it's a great springboard to other health professions. And we know within this state and certainly within the country, there is a healthcare workforce crisis, nursing, all of the therapies, even in primary care. And so I believe that a pharmacy technician experience can be a great springboard to a health professions career, regardless of where they go. But we'd like to use it as a springboard to recruit more folks into pharmacy and pharmacist roles as well. And then I think from a training perspective, it's important that we continue to adapt and evolve what we're doing and be very, very responsive to workforce needs. And so that's where I think having key industry partnerships, whether it be with health systems, whether it be with our community pharmacy partners, whether it be even in companies that are focused on automation in pharmacy, for example. These are all areas where their practice areas are evolving very rapidly. And through our partnerships, we can work together with them to ensure that they have the training and education that they want for their pharmacy technicians. And so a health systems business is delivery of health care. Community pharmacy is delivery of care in the community setting. Let them focus on delivery of care and let us as education and training experts provide that education and training. And so I'm really grateful to both of you that as we continue to try to expand this, that we're reaching out to our corporate partners, broadly defined, and finding ways that we can adapt what we're doing to what their needs, and particularly for more advanced roles. Certainly we've created this entry-level technician program, but I think the next step for us is going to be more advanced training to dovetail with those roles that technicians are taking on in community as well as in hospitals and in other places. And so I think it's again, it's a really critical area for us in the profession, again, if we're going to unleash the full potential of pharmacy. So, well, thank you to both of you for being with me today and sharing some thoughts. I hope you all found this content informative. If you have other topics that you would like us to cover, please feel free to leave a comment here and we'll cover those topics in future sessions. So again, thanks for being with us. As always, hail Purdue and boiler up.